Hi, I'm Dr. Carine of Carine Pediatrics. We are going to do a COVID update. We haven't done one in a really long time. And I want to talk about the rising numbers of COVID in our community and how we plan for Thanksgiving, which I know is on everyone's mind. Right now at this time, people are having a lot of what we would call pandemic fatigue. And that's somewhat contributing to our rising numbers in that a lot of people are saying, I don't really care, I'm tired of being locked up, I'm gonna go spend time with people. And it is really in those social interactions, and we know that from our contact tracing data, in those social interactions of family gatherings, churches, weddings, backyard barbecues, these times when we get together outside of a controlled environment that we are spreading COVID. The great news is that with all of the debates about masks work. So we are not seeing spread in places where masks are worn, like hospitals and food preparation and schooling environments. These are not places with a lot of spread. So what we know about that is unmasked gatherings of people tend to spread COVID, and masked gatherings of people for work-related issues where we're keeping some basic hygiene are not spreading COVID in any sort of large numbers. Things aren't 100%, but they're in general statistically playing out that way. So what does that mean? I mean, we have our kids in school, they're doing very well in school. The data coming out of Brown University's school tracking data says they aren't spreading in school with masks on, which is great news, but they are spreading within the community around those schools. Matter of fact, when schools are in session, we actually see less spread because we put kids in masks and we keep it controlled. It is those community gatherings that really lead to a lot of spread. We are still, as a society, trying to contain that spread through contact tracing and quarantine. So every decision we make when we spend times outside of our masked, controlled environments puts us at risk for quarantines, which can be pretty disruptive, both to children's education, to your jobs, and to the people around you. So every decision you make to be around people in an unmasked environment not just affects whether they catch COVID, but also reflects how much they can attend school or do their sports or go to work. So we have a lot of things we have to take into account as we make our decisions. I know there's a lot of people out there who probably are appropriately not too worried about COVID in regards to the danger to their children or maybe even to themselves. And so that's great news, but it is absolutely true that what we knew all along, which is that older people and people with compromised immune systems are at much higher risk of this disease than flu or other illnesses. It is quite deadly and dangerous to those patients. So as we see these case numbers going up in our community, we're also seeing those hospitalization numbers go up, and that's a better measure of true spread because as we test more, we will find more cases, but until recently, most of those cases were not being hospitalized, but now we are seeing hospitalizations go up within Ohio. So we are seeing real community spread to vulnerable populations as well. As you plan for Thanksgiving, I want you to take both quarantine issues into account and the risk to your older family members. I know a lot of grandma and grandpas are tired of being locked up, and it's true. You can't be lonely. Lonely is terrible for your heart, terrible for your health. People really need community. They need to know their families. These are serious issues that loneliness is bad for people, and our elderly population and grandmas and grandpas are getting tired of being alone, and they should be tired of being alone. So how can we spend time with them that is safe? A couple ideas. Of course, people are saying have Thanksgiving outside, although Ohio is not great for an outdoor Thanksgiving. If we happen to have some parting of the sun and clouds, that would be great, but I don't see that happening. So if you can, great. Whether that's in heaters in a garage or with tents outside, those would all be great options. Also, we have a large family in my life, and we don't even fit in homes a lot of times. So sometimes we'll rent like the gym or a hall at church or someplace with more air circulation. That would be a great idea if you wanted to get together as a family, and then maybe wear masks and keep some distance around your elderly family members. That would be a great way to gather and spend time together. What's great about it when we do that is then the kids can play basketball and play games, and Grandma and Grandpa always love watching them, so it's also a nice opportunity to have something for everyone to do. If you do meet within your home, because we know that masking is not 100% effective, but it is actually quite effective in reducing spread, it is important to consider wearing masks around your elderly family members. So perhaps you could have Grandma and Grandpa in one main room of the house, and when people go into that room, they wear their masks, and maybe they don't in other areas if they didn't want to wear them all day. There's some creative things you can think about to reduce the spread to Grandma and Grandpa, And I think it's real. And even if grandma and grandpa say, I don't care, you don't need to do that, remember, we will miss them if they get sick, and we love them very much. And so I think that it is in our own best interest, whether we're mothers or grandchildren or whoever, to keep the people around us safe, because we love them. So as you make decisions, you can call us and ask questions about details. And I also have been getting a lot of questions about, should we go back to school if you have a choice between online and school in January, if you've been all online. The data is really clear that children, even with chronic medical conditions, are doing great. So I've been getting a lot of, but my child has asthma, or but my child has type 1 diabetes, and none of these like kind of common childhood illnesses are increasing risk of COVID. So if you are keeping your child home for their own safety, I think that that is probably not necessary. If you are keeping your child home because you have high-risk family members, and you don't want disruptions from quarantines, or you want them to be able to visit grandma, or whatever other reason you might keep them home, then that is completely valid and you should make those choices. But if you are afraid for your child themselves, all the data indicates that they are safe at school. If you have questions about your particular child, go ahead and give us a call. But all of that news is very good. All right, thanks everybody, and I hope you have a safe Thanksgiving.